want to say good afternoon to everybody. First and foremost, I want to give an update on our testing sites, both National Guard sites, Midtown and UMOS. They're open again today after being closed yesterday for a day off. This week, the sites have slightly adjusted their hours, so they're going to be open from 11 a.m. to 8 p.m., but this will not limit their ability to run the same number of tests. Both sites will be open through this Saturday, and toward the end of the week, the National Guard will assess what the next steps of these locations will be. I also want to remind people that there are other options available to get tested if you are having symptoms. All 5 community health centers and many of our private healthcare providers are offering tests. So if you have symptoms, please call 211 to get linked up to one of these testing sites. Our partners at 211 will help connect you to the nearest community health center or local hospital. So it's extremely important you call. I also want to address the recent coverage of Milwaukee County municipalities pulling out of their safer at home orders. I want to reiterate the importance of making decisions about reopening based off of science and the data available to us. I know we're all getting restless. I have 3 girls and 2 of my oldest are really anxious to get outside, start playing with family and friends, and get back to the normal routine. And I can definitely tell you this is not what I envisioned my first few weeks as county executive looking like. But we must be patient and take a phased approach to restarting the economy. In the coming days and weeks, more restrictions will be lifted throughout the county. And it's easy to think that we're approaching normalcy, but we are not getting back to our old routine. So I don't want people getting comfortable thinking that we've reached the light at the end of the tunnel, because that would be dangerous thinking. We're only at the beginning of combating this virus, and we still must practice physical distance, good hygiene, and think about how we travel and what errands are necessary. We can look at other states as an example of how letting up too much on these guidelines can cause a negative effect and further hurt the economy. So as you begin to patronize businesses, please review the list of best practices the Wisconsin Economic Development Corporation published regarding appropriate guidelines businesses should be following to keep their consumers safe. And while we're continuing to talk about the Wisconsin Economic Development Corporation, they've recently announced a $75 million assistant grant program that Governor Evers has put out for small businesses as part of the WEDC's We're All In initiative. And this is going to be critical funding to help our small businesses get back on their feet and help support best practices to keep businesses, consumers, employees, and this community safe, to be quite frank. But also as part of this funding, WEDC launched an Ethnic Minority Emergency Grant Initiative with a total of $2 million available to support about 1,000 Wisconsin micro businesses. They can apply for a one-time grant of about $2,000 for short-term operation assistance. And these applications are being accepted and beginning today through May 24th. So if you need to apply, please go to wedc.org for more information, and I will pass it over to Mayor Tom Barrett. Thank you.
Well, thank you, Mr. County Executive. Thank you very, very much. Well, good afternoon. I want to begin by talking about the issue of tracing and where the city is, because I think that this is an important part of the conversation as to how we manage this and how we prevent the spread of COVID-19. You'll be hearing from Dr. Weston after I speak, and he'll talk about the number of cases. And what we have seen over the last few days is, if I'm not mistaken, is an increase in the number of cases of COVID-19. Now, that doesn't mean that the disease is more widespread than it's been. I think this is in large part as a result of the increase in testing that has occurred. And I'm very thankful to the National Guard for the work that they've done to help us have more testing. But inevitably, when you have as much testing as we have had now over the last week, I think last week we had probably 11,000 people that were tested overall at the 2 sites, the 2 community sites, you're going to see an increase in the positives. What that means, though, is that there's going to be an increased workload for local health departments, for the state health department, for suburban health departments, to deal with the tracing that has to occur. And what I mean by that is when someone is diagnosed as positive with COVID-19, they are contacted by the health department. Following that call, because there'll be a conversation, most likely it will take place between a representative of the health department, a representative of the state, and that individual. And they will talk about the people that they've been in contact with. That's when the tracing begins in earnest, when we know the individuals that you have had contact with. We know for COVID-19 that 2 days before you show symptoms that you are going to be in a situation where you can be spreading the disease. We know that people can be asymptomatic and still spread the disease. But once you are tested positive, what the health department is going to do is they're going to look at the date when you first felt the symptoms, go back a couple of days, and have you self-quarantine yourself for a period of up to 2 weeks. And Director Christensen can talk about the particulars of that if she wants to. But in addition to that, that is when the tracing portion kicks in. When we began this, we had approximately 12 people who worked on tracing, and it was mostly for communicable diseases at the city of Milwaukee. This, of course, is also a communicable disease, but it's a much different animal from the communicable diseases that normally the health department works on. And so what we've done over the last several weeks is ramped up considerably the strength of our department. That, coupled with the partnership, the excellent partnership we've had with the state of Wisconsin, and the guidance that we have received just in the last week from the CDC, puts us in a place where we feel that we can move forward and responsibly deal with the tracing caseload that we have before us right now. Let me be even more specific. When CDC was here over the last week, they felt that for surge capacity, it would be ideal if we could have 180 to 200 people who would work on tracing. Again, if that's at the surge capacity, which we are not at right now. Where are we right now is the obvious question. Prior to this week, we had approximately 80, maybe 88 people that were ready to go to do tracing. And this week, we're adding an additional 70 people, primarily from our library system, who are going to help with the tracing. So right now, we're by the end of this week, we will be in the 150 to 160 range of individuals who can help us with the tracing. In addition to that, there's the Weavers program, which is the volunteer program, and our health department is starting to look into making those contacts right now as well. So there's a lot of work that needs to be done to do this tracing. But keep in mind, what we want to do is basically surround the disease. And what I mean by that is if those individuals test positive or if they've been diagnosed as someone or have been in contact with someone who's tested positive, to make sure that they're limiting their activity. One of the questions that's come up, and I just had a neighborhood call before this, was enforcement. And I'm going to talk about where we are right now as a community, but this is, I think, important to add at this point. Twice in the last couple of days, the Milwaukee police have had to issue a quarantine order for individuals who have tested positive, but who have refused to stay at home. This is not acceptable. And I don't know anybody who is going to be supportive of individuals who have tested positive for COVID-19 who refuse to abide by the quarantine or self-isolation orders. That is where you will start seeing the police department getting more involved in an enforcement status. Our police primarily up to this point have been there to educate people about the safer at home orders and how important it is to do the social distancing. But if you are an individual, or if you know an individual who has tested positive for COVID-19, that does not give them the license to go to work or to go to church or to go out with their friends. That is where things start getting very, very disconcerting for our public health officials and for the medical personnel overall. So that is something that I think the community needs to be aware of. Finally, I want to talk a little bit about the local orders because I think that there's a lot of concern given the Supreme Court's decision last week. And I thought it was somewhat ironic, quite honestly, where going into the case, the legislative leaders were saying, well, we want to have an opportunity to sit down with the governor and work out a statewide plan that makes sense. Once that decision came down, it became crystal clear that they never had any intention whatsoever of sitting down with the governor to work out a plan. They'd be more than happy to talk to him on the phone. But as you've heard the legislative leadership say, they view this as a local issue. That has caused a lot of confusion and a lot of disarray throughout the state of Wisconsin. The city of Milwaukee still has an order in place. That order was issued last Thursday. We do not have an expiration date on that order, but needless to say, I want to go back to life as normal as quickly as possible. So I will be meeting with our health department, as I do on a daily basis, over the next few days to see how we dial life as normal back up. with the suburbs, and Director Christensen can talk about the status of the suburbs. It's my understanding that they might be taking some action later this week based on the action they took that did have a expiration date, but I'll let her talk about that. So again, for those of you who live in Milwaukee, if your business is in Milwaukee, keep in mind that there still is an order in place. Part of the reason that I think this is important is just over the weekend, for example, the health department, Barbicide, which is a local company that's involved in healthcare, and I had a webinar where we had close to 1,000 people involved in the hair salon, the beauty parlor, the barbershop, the nail salons that want to know what are the best practices for going back to work safely. And it's a concern for the businesses, but it's equally a concern for the employees of these businesses. And I think most importantly, for these businesses who want to get back into circulation, their customers have to feel that they're doing everything possible to make them safe. And so if we're going to return back to normal, it's going to be because the customers feel like they can come back. So as the county executive said, we've got a long way to go, but I think what you're seeing is people who are working around the clock to try to get life back to normal as quickly as possible. So with that, I'm going to turn it over to Dr. Weston and thank him once again for all the great work that he's doing. Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. We now have over 5,040 to be exact, cases of COVID-19 in our community and 236 individuals who have died. As we see this warmer weather, businesses reopening, and stay-at-home orders going away, it's tempting to think that we are approaching the end of the pandemic. And I think none of us would be faulted for falling into this comforting feeling of moving on. I'll admit there's times when I get a small sense of relief that perhaps the worst is over. It lasts for about 2 seconds until I come to my senses, but we have all experienced these moments of a seeming sense of return to normalcy. However, I think when we step back from those moments, we know that in the long course of this pandemic, we're just finishing the first inning of this baseball game. As we pull back physical distancing and stay-at-home orders in much of our state and much of our region, I think we face the most dangerous time yet. Up to this point, we've battled this virus in a somewhat artificial environment of working from home in many cases, not visiting with family and friends, and not engaging in the everyday social experiences that we may typically have. Under these conditions, the spread of COVID-19 is severely limited. And under these physical distancing conditions, we have managed to hold back an overwhelming surge in cases, in deaths, and in hospitalizations. But now, moving forward, COVID-19 will spread in a different landscape, one in which close contact becomes more abundant, and undoubtedly the spread of the disease takes on a more rapid pace. That said, we can't close ourselves off to society forever. We must take steps toward normal, but we must proceed in a measured way. And while the most reliable method for consistency in that approach combines public health education with public health orders, the latter may not be achievable in many communities. Facing this reality, education and messaging becomes more critical than ever before. COVID-19 is simply a virus. It's a piece of genetic material. Its one job is to enter your body, replicate, spread to someone else, and keep going over and over. And until we have a vaccine, perhaps in a year or more, it's not going to go away. So we must be careful as we move forward. Looking at past pandemics and considering the mechanics of the virus, there's no reason to think we're at any semblance of an endpoint here. We're at the beginning of a long road, and moving too fast can put us back to physical distancing and stay-at-home orders. With a gradual return to normalcy, however, we can hopefully find a balance between living our lives, getting sick, no doubt, but having a health system with the capacity to manage that burden of disease. So enjoy the warmer weather, but be cautious and consider the risk as you begin to step back gradually to a more normal way of life. Thank you and stay safe. And I'll pass it back to Catherine.
Thank you, Dr. Weston. Really appreciate it. And now I will hand it off to Director Ann Christensen.
Hi, thank you. So I'm from the North Shore Health Department, and I represent the 7 communities in the northern part of Milwaukee County, from Shorewood up to Brown Deer. Happy to speak on behalf of the local health departments. As a little bit of situational awareness, we are starting to see, as Ben pointed out, more tests come in, both negative as well as positive tests. In fact, in looking at the Milwaukee County Office of Emergency Management dashboard of last week, on Friday, there was the high record number of high new cases. And again, that's likely attributable to the increased availability of testing, as well as a potential increase in disease spread in our communities. One factor that may be increasing the number of cases is the further loosening of restrictions and more mobility for people out in the community. And we see that at the local health department level as we look at the number of people that have COVID and start to identify those contacts that was mentioned by Mayor Barrett. Say a month ago, we were seeing contacts in just members of one's own household based on the safe at home order. And now we're starting to see those contact investigations increasing to be more of the outer circle of people. So friends, family, as well as workplaces. So that to me is an early indication that we are out and about more so than we were. And with those loosened restrictions, health departments will continue to see those contact investigations increasing. So it's important that if you are out and about, that you're following those protection measures for your own safety, as well as those who are vulnerable, making sure that you're wearing your cloth face coverings, that you're practicing good hand hygiene, and that you're staying physically distant so that you're staying 6 feet away from others. Those will help you as well as others when you are out and about. Local health departments have also been working with workplaces and businesses in our region as we start to think and work toward reopening and safe reopening. We've been issuing the WEDAC, Wisconsin Economic Development Corporation, guidelines to those businesses so that they can start to plan for when they're going to begin reopening if they haven't already. We work in partnership with them for the prevention aspect. So what can they put in place to help protect their customers and their employees? We also work with those businesses when there are cases of COVID in their workplaces. That is one of our key roles, is preventing further transmission in those environments. And we work in partnership with employers to support people who are cases to be staying at home in isolation for 10 days. That's a long time, but 10 days plus 3 days of resolved symptoms. So that could potentially be a fairly long time for some employees. And then we also work with employers for people who have been in contact with positive cases to allow them to be quarantined for a period of 14 days. Again, that's important so that we stop the spread of COVID. So again, trying to educate the workplaces, the employers, so that they're aware of what the guidelines are for isolation and quarantine. So that's one way that we will continue on our role as businesses begin to reopen, again, in partnership and working with them to support their practices, both on the prevention side, but as well as on the control side. So as we look to further loosened restrictions and a time where we're able to reopen our businesses, that'll be an important role that public health plays, in addition to other aggressive tracking of cases and contact tracing that's been mentioned. Those are my public health updates, and look forward to working with the community on our next phases of reopening. Thank you.
Thank you, Director Christensen. I'll now hand it over to Colonel Aaron Reisinger.
Thank you and good afternoon, Mayor Barrett, friends, partners. Really appreciate the opportunity to be with you today and update you on the project that we have ongoing. So first, it's always important to remember that the Corps of Engineers receives our mission assignments from the Federal Emergency Management Agency, and really an effective partnership at the federal level between us and FEMA to bring these resources to bear to help solve part of the challenge that I know exists in this COVID-19 pandemic era. So our primary purpose is obviously constructing alternate care sites. We worked on the one at the fair on April 30th. We received a mission assignment task order from FEMA to construct 120 COVID-19 patient care spaces at the Lauder Building at the Milwaukee House of Corrections in Franklin, Wisconsin. We were able actually to award a contract to Gilbane Building Company on that same day, and work commenced nearly immediately within 24, 48 hours. After about 16 days of construction, we're completing that construction as we speak, and we'll turn over the facility on Wednesday of this week to the state. And really, I want to emphasize our appreciation of the partnership there in Franklin and with the Department of Corrections and the County of Milwaukee, and all the effort everybody's put into helping us really make decisions quickly and move really fast to this project. Some of the things that we've done to this point to give some scale is really, it's important for us to create a safe working environment for the healthcare workers and the correction officers and the patients. So that's first and foremost in our scope. You know, some of those things include establishing safe donning and doffing areas for the healthcare workers, the corrections officers, nurse stations, break areas, re-engineering the air handling system, filtration systems in the building to create the right conditions for the infected disease, the COVID-19, testing and repairing the water systems, including replacing the hot water generation systems, inspect and repair all the fire suppression throughout the building, extensive repair of the roofing systems to protect the envelope of the building, and really then a lot of work to create a safe environment for the patients, a lot of emphasis on the finishes, the restrooms, the showers, and then also an extensive effort to create an environment such that we can provide inline oxygen to up to 30 patients with an oxygen med gas system for medical oxygen there that can provide to more acute patient care for up to 30 patients there. And then really providing all the tools necessary to create the safest possible environment for the workers and the patients. So really what remains at this point is a lot of testing, certification, what we call demobilization, and then cleanup of the contractor and the subcontractors there today and tomorrow. And then, we'll turn over the facility on Wednesday, the 20th, and it will be prepared to receive, equipment, staff, and patients as necessary. I just want to say again, the Corps of Engineers has been super proud to help be a part of the solution set for the state, the county, and the cities in Wisconsin. We've worked closely with Gilbane Building Company, FEMA, and all the other officials to get this done. I may have said this before, 26 years of military service, not too many times I've seen so many people come together with such a focus on outcomes and really just bringing their A game to the table and helping us, everybody make decisions and move forward in a very smart, deliberate, and really very effective way in a short amount of time. And